Does everyone lose their hearing as they get older? It's a question most people don't want to ask, but almost everyone wonders. At some point, the world starts to feel a little quieter. Voices aren't as clear. Restaurants feel exhausting. The TV volume keeps creeping up. And then the worry sets in. Is this normal, or is something wrong? For decades, hearing loss has been treated like an unavoidable part of getting older, like gray hair or wrinkles. But that belief is only partly true. Hearing loss is common with age, but it's not inevitable. And understanding why it happens may be your key to protecting your hearing for years to come. What really happens to your ears? Over a lifetime, your ears are biological marvels, tiny structures performing complex mechanical, electrical, and neurological tasks every second of your life. Deep inside the cochlea live tens of thousands of microscopic hair cells responsible for translating sound waves into signals your brain can understand. These cells age along with the rest of your body. Over years, they face constant friction, stress, and strain. But unlike skin or blood vessels, these cells can't regenerate. Once damaged, they don't grow back. However, the natural aging process alone is not enough to destroy them entirely. What really harms them in most people is a lifetime of noise exposure, illnesses, medications, and lifestyle factors that build up silently over decades. Aging is often blamed, but it's not the sole cause. The scientific term for age-related hearing loss. Doctors call age-linked hearing decline presbycusis. It's one of the most common conditions affecting older adults. But presbycusis itself is not a single disease. It's the result of many different stressors accumulating over time. Some people genetically inherit stronger ear structures. Others live lifestyles that protect or harm hearing. Two people at age 70 can have dramatically different hearing abilities depending on their environment, habits, and medical history. Presbycusis affects both ears equally and progresses slowly, so it often goes unnoticed until it significantly impacts daily life. High frequencies usually fade first. This is why older adults often say they can hear sounds but can't make out speech clearly, especially consonants like S, F, or T, which live in the higher ranges. Why some people lose hearing and others don't. One of the most fascinating and encouraging truths is that not everyone experiences significant hearing loss as they age. Studies of older adults show that some maintain exceptionally good hearing well into their 70s, 80s, and even beyond. The differences between those who decline and those who don't usually fall into three major categories: genetics, lifestyle, and environment. Some individuals are biologically fortunate and inherit cochlear resilience. Others have spent their lives in quiet environments or used protective equipment when exposed to loud machinery or music. Many also avoided ototoxic medications, drugs that can harm hearing cells. And some people protected their cardiovascular health, which plays a surprisingly large role in hearing clarity because the ear depends heavily on fine blood flow. The conclusion is clear: hearing loss is common, but not universal. Noise exposure, the true culprit behind most age-linked hearing loss. If aging were the only factor, people would lose hearing at a predictable, uniform rate. But that's not what happens. Some 70-year-olds struggle to understand phone conversations, while others hear normally with no difficulty. The difference often lies in noise exposure accumulated over a lifetime. Modern environments are much louder than those of past generations. Traffic, construction, restaurants, concerts, headphones, nightclubs, gyms, and powered tools bombard the ears with intense sound daily. Even moderate-level noise, if experienced for many years, chips away at the fragile hair cells inside the cochlea. This long-term damage adds up, and eventually people assume that age, not noise, was the cause. In reality, the ears are often paying the price for decades of sound abuse that went unnoticed at the time. Other factors that contribute to hearing decline. Though noise is a major player, it's not the only one. Certain medical conditions subtly erode hearing health over the decades. Diabetes, high blood pressure, smoking, untreated infections, poor circulation, and chronic inflammation all damage the microscopic structures inside the ear. Some medications, antibiotics, chemotherapy drugs, and even large doses of aspirin can accelerate decline. The cumulative effect of these factors can mimic or exaggerate age-related hearing loss. Why hearing loss seems inevitable, even when it isn't. Part of the misconception comes from our interactions with aging family members. Because many older adults have the hearing loss, we assume it's a universal part of aging. But what we're really seeing is the result of decades of unprotected noise exposure, untreated medical conditions, and lifestyle choices. The idea that everyone loses their hearing eventually becomes a cultural myth that discourages prevention. This belief is dangerous. It leads people to ignoring early symptoms, skipping hearing tests, dismissing ringing in the ears, and blasting headphones louder than necessary. The myth becomes a self-fulfilling prophecy, but awareness changes everything. Once you understand the true causes, you can protect your hearing far more than you ever imagined. What aging really does to your ears and what's preventable. Aging does naturally change some physical structures. The membranes in the inner ear stiffen, blood flow slows down, cells accumulate damage from oxidation and normal wear. But these natural aging effects alone usually cause mild hearing decline, not the severe losses most people experience. The biggest contributor is preventable noise damage. In other words, most of the age-related hearing loss that people talk about is actually the delayed result of lifelong exposure to sounds that were too loud for too long. Why early awareness matters more than anything. One of the challenges with hearing loss is how slowly it progresses. Because the decline is so subtle, people wait far too long before seeking help. By the time many address it, years of avoidable damage have already taken place. Early detection allows for lifestyle adjustments that can preserve remaining hearing and slow further decline. Many older adults who maintain good hearing throughout life share a common trait. They paid attention early. They avoided excessive noise, treated ear infections promptly, protected themselves around machinery, and took their auditory health seriously before problems appeared. In other words, they didn't wait for damage to catch up with them. So, does everyone lose their hearing with age? The short answer is no. Age increases the risk, but it does not guarantee hearing loss. The long answer is more nuanced. Aging combined with years of environmental and lifestyle factors can significantly increase the chance of hearing decline, but the outcome is highly individual. Some people experience only mild changes. Some experience none. Others develop severe hearing loss if their ears endure decades of stress. The truth is simple. Aging affects the ears, but your choices and environment affect them far more.
Hearing loss is common, but it's not inevitable. Understanding how aging, genetics, noise, and lifestyle affect your hearing is the first step towards protecting it for life. If you want clear, evidence-based videos about hearing loss, tinnitus, and how to protect your hearing long-term, make sure you like, subscribe, and turn on notifications, because there's much more coming.